In today's video, we're going to talk about the Medicare Savings Program. Did you know there's a program that will pay for your Medicare Part B premium? And that's what we're going to go over in today's video. Like I said, it's called the Medicare Savings Program. Basically, this is Medicaid, and the Medicare Savings Program will pay for your Medicare premium. Okay. So what is the Medicare Savings Program / Medicaid? So basically every state have this program and the qualifications is based state by state, okay? Now in a nutshell, it's for low income individuals, low income families, pregnant women, and seniors as well. So this video, we're going to focus on low income seniors. So if you're disabled or 65 and older, you're low income and you have limited resources, then you may qualify for the Medicare Savings Program. You will go to your state website. For Florida, we'll put the website right here. So in order to apply, you have to go to your state websites for Medicaid, okay? And these are the boxes I want you to check when you're applying for the Medicare Savings Program and Medicaid. You're going to check the box that says health insurance, Medicaid. You're going to check the box that says Medicare Savings Program. You're going to check the box that said for individuals that's disabled or age, and age is for individuals 65 and older. So you're going to check those three boxes to apply for the Medicare Savings Program / Medicaid. Like I said, this program, if you get approved, will pay for your Part B premium. There are three main different levels of Medicaid, and we're going to go over these three different levels and what they actually pay for. So level number one is QMB, which is your qualified Medicare beneficiary. And QMB level is the highest level of Medicaid and is going to be based on your income. Like I said, income and limited resources. Limited resources meaning you can have one house, one car, and less than $9,000 in the bank, and you have to have low income as well, okay? So what QMB does, it will pay for your Part B premium. It will also pay for your deductibles. This is Medicare deductibles, your co-insurance, and your co-payments as well. So if you have QMB and you're seeing a doctor that accepts Medicare, your doctor cannot send you any bills. He would have to send any remaining costs over to Medicaid, and Medicaid will pay the difference, okay? Because like I said, if you have QMB, it pays for your Part B premium, your co-insurance, your co-payments, and your deductibles, okay? Meaning that you do not have to come out of pocket for any Medicare-related services. Okay, we got that out the way, right? Now let's talk about the second level of Medicaid, and this is SLMB. So SLMB stands for your Specified Low-Income Medicare Beneficiary. Now with the second level of Medicaid, this means that your income is slightly higher than the individual that got approved for QMB. With SLMB, it's not going to pay the additional costs such as Medicare co-payments, co-insurance, or deductibles. What it will do, it will pay for the Part B premium, which is still really nice, okay? So if you go to the doctor and there is additional co-pays and such, then you will be responsible for those additional co-pays, okay? Now let's go over the third level of Medicaid, and this is QI, and this is for qualifying individual. That's what it stands for. Same thing with SLMB. It covers pretty much the same thing. It's not going to pay for the extra additional costs associated with Medicare, like it won't pay for your co-pays, your deductibles, or core insurance, but it will still pay for your Medicare Part B premium. Of course, if you get qualified for a QI, it means that your income was a little more than the SLMB level, but your income was still low enough to be considered low income, okay? And it's the same when it comes to like the requirements for all three: limited resources, limited income. You can have one house, one car and less than $9,000 in the bank. Now, when it comes to QI, it is based on first come, first serve basis, okay? So it's very important to keep note of that. If you qualify, I highly recommend that you apply for one of these programs, and I will leave the income requirements in the description of this video for each level of Medicaid that we talked about in today's video. And also, it's very important to take note, depending on your state, if you do get approved for Medicaid in one of these Medicaid levels, did you know you could also apply for a dual special needs plan when it comes to Medicare Advantage plans? So what is a dual special needs plan? This plan is designed, and these are Medicare Advantage plans now. These plans are designed for individuals that have both Medicare and a Medicaid. They hint word dual, which is short for D-SNP, okay? So you could apply for one of these plans if one of these plans are available in your state, your zip code, and your area, because it is area-based. Now, the good thing about these plans is that a lot of times your co-pays are very low in cost. In a lot of cases, your co-pays will be $0. So that is nice to know. And sometimes there's extra perks when you're on a D-SNP plan as well, such as a healthy food spending allowance card, which is really nice, okay? So I would highly recommend that you get on a dual plan if you do, in fact, is approved for Medicaid. If you need any help with any of this, give our office a call. We'll be more than happy to assist you. If you have any questions, leave them in the comment section below. We'll be more than happy to answer your question. Thank you so much for watching this video. If you know anyone that needs this information, definitely share this video with a friend and subscribe if you're not subscribed. Thank you so much for watching, and I'll see you on the next video. Bye.